Hello, my name is Leonel Cortinas Jr., retired military after 20 years. The cause of my SI joint pain I believe to be from military service after 20 years of jumping out of aircraft, doing PT, road marching. My SI joint pain limited me from playing golf, walking, standing, sitting, bending for prolonged periods of time. What made me decide to go through surgery was after my lumbar surgery, I was still experiencing pain, and this was about 18 to 24 months after. I was referred to Dr. Wilson for further examination of the SI joint.
I'm Dr. Kelvin Wilson. I am a neurosurgeon currently in military practice in San Antonio, Texas. Although I practice general neurosurgery, my primary focus is minimally invasive spine surgery. The sacroiliac joint is the largest joint in the body. It lies between the pelvis, or what patients commonly refer to as the hips. Its major purpose is to carry energy from the low back into the legs. It does not allow a lot of movement, but in certain conditions, it can become inflamed and can cause significant pain and distress. The studies have shown us about 13 to 20% of patients that come to us with low back pain actually have sacroiliac joint pain. Some of the complaints with sacroiliac joint pain can be very similar to other complaints that we see with low back pain, such as a pain that radiates down the buttock into the leg. Patients will often say that their sacroiliac joint pain is worse at night, and they often require shifting positions during the night to try to find some comfort. Also describe sort of a catching sensation when going from sitting to standing, or when going from standing to sitting. There are three major components to the diagnosis of SI joint pain: the history, the physical exam, and a diagnostic injection. In the history, there's minor trauma such as being involved in a car accident or even participating in sports activities. We know that up to 40% of patients that have undergone lumbar fusion surgery will present with sacroiliac joint pain. During the physical exam, there are certain provocative maneuvers that help determine if the sacroiliac joint is the origin of the pain. We often look for 3 out of 5 of those maneuvers to be positive, and we also look for something called the Fortin finger test. We ask patients to simply point to where your pain is, and that position is just below the belt line, just off of the midline. Diagnostic test that we look for is a sacroiliac joint injection. And we look for a positive response of greater than 75% improvement in your pain. There are a multitude of conservative options that we really need patients to attempt before pursuing the fusion. Physical therapists can perform a variety of maneuvers to help stabilize, at least temporarily, the sacroiliac joint. If you have sacroiliac joint pain and you fail at least 6 months of conservative therapy, minimally invasive SI joint fusion is a very successful option. My personal preference is to use the SI-Bone iFuse implant system. They are a series of triangular implants that are placed through a 2 to 3 centimeter incision. The triangular shape restricts rotation. This is a surgery that can be performed in an outpatient setting, and several studies have shown that up to 90% of patients get significant relief of their SI pain when using an iFuse implant system.
I can walk without limping. I can actually cross my legs again. I was able to play golf again, or attempted to, about 2 months later. It has turned out fantastic, and I would have to attribute to having a good surgeon and full trust and confidence in him.
If you're a patient that suffers from low back pain and you think that the sacroiliac joint may be a cause of your pain, I would be delighted to see you in clinic, evaluate you, and see how we can take care of this. You can find my current practice information as well as email me at drkelvinwilson.com.